What job would you do? What job do you do?
Well, at the moment, I've got 3 different jobs. Let me tell you a little bit about them. So the first job that I've got is the leader of the Community Learning Disability team. And we are a team that work with adults. There's 47 staff in the team, and we've got a big, broad, multidisciplinary team. So I do that for part of the week, and then I've got somebody that job shares with me, Claire Lamb, and she helps me with that. So it's been a difficult year for everybody. I'm sure you'll probably agree.
Yeah.
So our job now in the next 12 months is to support people to get back to their normal lives. Some of our people have lost their confidence a little bit and lost skills. So the Community Learning Disability team are hopefully going to help people to get back on track and put their lives back on track. Now, another job that I've got, Adele, is that I work with all of the AHPs. Do you know what an AHP is?
No.
It's an allied health professional. So it's not the nurses and the doctors, it's some of those other people. So it's the occupational therapists, the physiotherapists, speech and language therapy, and dietitians. Now, we haven't got many of those in the trust at the moment, and we haven't got many in learning disabilities. So we've got to work really hard to make sure that the people who need them get access to them. And then the last job that I've got is new. I've only been doing it a few weeks, but that's kind of the clinical lead job. So that's across all of the learning disability services, and it's just a part-time role, but it's making sure that we all work together really nicely. So the community team, the intensive support team, the children's team, the assessment and treatment unit, so that if a client comes into those different services, they have a really good experience, and that we get to do all of the things that the government is telling us to do, and that we're as helpful as we can be. So we've got a busy year ahead, and there's a lot of projects that we've all been working on. Do you want me to tell you a little bit about some of them?
Yes, please.
But I think you might know some of them already. So after working for a number of years, we've managed to get our experts by experience into post, and we've got 4 people who've accessed our services before that are now going to start working with us, giving us advice and support. And I think you know some of them because they've worked in the Talk and Change group with you previously.
Yeah.
So that's going to be really exciting, experts by experience. We've got a little bit of new money coming into the service this year, so we've got a new team developing around positive behavioural support. We've got a new team developing around people that are coming out of prison or coming out of long stay hospitals, and they're going to find it hard to get back out there into the community. So we need to do what we can to make sure that they have a successful journey from being in a hospital or being in a prison to coming back into the community. We've been given some extra money to look at the children's services, and especially the children that are having a difficult time, and making sure that they've all got a key worker, like their special person, their special person who can help them make sense of everything and get them through the services and get them to the services that they need. We're really trying hard to keep people out of hospital, so we want to try and understand who we've got and who's struggling a little bit, who's going into crisis. So we're starting to work on getting together this special register of people so that we can work with them in advance and try and keep them out of hospital. And we're also working on some pathways. So at the moment we do lots and lots of different pieces of work, and different people might do that slightly differently. And with our pathways, we're going to make sure that everybody's doing the same thing with the people that need those services. So that might be around risk and vulnerability, around physical health, around enabling independence, and their mental health. And the big piece of work that we're going to do this year, hopefully, is really improve our digital work and how we use the internet. Now, I know that you're very good at social media, but some of us staff, we're definitely not. So we're going to try and do better, really, around what we do digitally and what we can do on email, so that people can access the team in different ways, and they haven't just always got to come to Broome Street or always got to ring up. They might be able to send us an email, or we might be able to talk to them on a chat or something like that. So we're going to really work hard with digital. So yeah, so it's an exciting year ahead. Lots of things to do.
Yeah.